Hi guys, just starting our lower back and hip focus flow. You're not going to need any equipment today. You're going to come and lie on your backs. So, start laying on your backs with your feet hip distance apart. And we're just going to work on our connection. First of all, so where we should be feeling connected is underneath both our feet, underneath our lumbosacral junction, underneath our TL junction, both shoulder blades and the back of the head. So we'll start back at the feet, and what we're going to do is we're going to start to shift the weight from side to side. And what we want to feel is that equal pressure underneath the right and left foot. So when you feel like you've got equal pressure, you're going to pause. And then you're going to think about where you're feeling the pressure. Are you feeling it underneath the outside of the foot or the inside of the foot? If you're feeling it on the outside of the foot, you're going to try and bring that inner arch down towards the floor by pushing the big toe into the floor, but keep your knees pointing towards the ceiling. Keep the ankles neutral. So what you don't want to do is start to push the big toe down and the knees cave into each other, because then the outer part of the foot's going to lift. So you want to keep the outer part down. If you're feeling it more on the inside of the foot, you're going to do the opposite. You're going to try and bring that outer arch down towards the floor, but keep that big toe connection. Keep your knees pointing to the ceiling. So once we've got our foot connection, you're going to move up to your lumbosacral junction, so junction between your lower back and pelvis. And we're going to start to peel the spine away from the floor, taking the lower back into an arch and the pelvis into an anterior tilt. Then you're going to reverse peel the spine, taking the spine into the floor, taking the pelvis into a posterior tilt. And we're just going to go forwards and backwards between anterior and posterior, lumbar extension, lumbar flexion. And then I want you to pause in the midpoint between the two end ranges, where your lower back's going to feel flat on the floor. So if you try and put your hands behind your back, you shouldn't be able to get your hands behind there. And then your lumbosacral junction should feel nice and connected. So then you're going to move up to your TL junction, so your junction between your upper back and lower back. And what we want is for the ribs and pelvis to be connected. So you're going to think of your ribs and pelvis like they're the pages of a book. We want the pages to be closed, we don't want them to be open. So if you have a feel onto your lower ribs, and if you can feel them poking up towards the ceiling or up towards your head, then you've probably got the open book. So we're going to try and close the book, bringing the ribs and pelvis down into connection, and your spine should go into a more neutral position, and your TL junction will feel more connected. Then you're going to move up to your shoulder blades, so they want to be equal from side to side, so shuffle the weight from side to side until you feel that you've got equal connection. And then you're going to think about the shoulders. So the shoulders themselves want to be neutral. We don't want them elevated and forwards. So we're going to try and bring the shoulders into external rotation and depression, pulling the shoulder blades down towards the back pocket on the same side. And you're going to bring them back towards the mat slightly. So you're not pulling your shoulder blades together, you're not pinning them down towards the floor, but you're just bringing them back slightly towards the mat. And then we're going to go up to the head. So back of the head is going to push straight down towards the floor. We're going to try and avoid going into any neck extension. And we're going to try and avoid bringing the chin down towards the chest. So the back of the head's going straight down towards the floor, eyes pointing towards the ceiling. Okay, so we've got our connection now. Try and maintain that connection throughout the rest of this this breath work part. So put one hand on your chest, one hand on your tummy, and we're going to think about getting our breath in the right order now. So as you take a breath in, what you should be feeling is the hand on the tummy lifting, and then as you breathe out, the hand on the tummy is going to lower. So the hand on the chest doesn't want to move anywhere, that's staying completely still. So really try and visualise and focus on what's happening. And just focusing on trying to lift the hand on the tummy with the breath in, and trying to lower the hand on the tummy with the breath out. Close your eyes so that you can just focus completely without any sort of visual disturbances. Let's do a few more breaths. Okay, so once you feel like your breath's in the right order, then we're going to put our hands around our waists. So thumbs digging into the back, web of the hands around the waist, and then the fingertips are digging into the front. And what we want to do now is to create our 360-degree breath. So as we take a breath in, we should be feeling all the muscles around the abdominal wall expand. So as they expand, they're going to lift your hands away and push your hands away. So you should be feeling this equal from front to back and from side to side. So if you're struggling to feel those muscles, then you're going to try and wake your muscles up to let your brain know where they are. So to do that, you're going to cough. Do a big cough, feel those muscles expanding when you cough. And now try and focus on those muscles and think about those muscles doing the same movement, expanding and pushing your hands away on the breath in and then relaxing on the breath out. And if you breathe in through your nose and out through your mouth through pursed lips, imagine you're blowing through a straw. And remember, we want it equal from front to back and from side to side. So if there's any area that you're struggling with, so if you can feel it more on one side than the other, or you can feel it more at the front than the back, then you're going to just try and focus on the bits that you're struggling with. So give it a poke, give it a prod, wake the muscles up, cough again if you need to. And then try and focus on those muscles that you're struggling with. Okay, so throughout this flow, you are going to be concentrating on trying to create that 360-degree breath. And then when you're doing something that needs more stabilisation, you're going to need to know how to create your brace. So the brace isn't a clench, it's not a tense, and you're not sucking your belly button towards your spine. We're going to create the 360 breath, and then before you take your breath out, you're going to do an outward push like you're imagining that you're about to fart, and now try and keep the muscles completely active as you breathe out. And now as you're breathing in and out, keep that activity in the abdominal wall, so keep that feeling like you're about to fart. One more breath. Okay, so we're going to start by doing some hip extensions now. So single leg hip extensions. So slowly push one foot away, and as you push the foot away, try and maintain that neutral pelvis, neutral lower back. So don't let the pelvis or lower back lift off the floor. And then you're going to slowly pull the leg back in, and then swap sides and do the other side. Just go as far as you feel comfortable with the leg, so you don't have to fully extend the knee and hip. You can go part way if you want. If your lower back, if you're not able to maintain that neutral pelvis, neutral lower back, or it's uncomfortable, just go part way. And then you're gonna, from this hip extension, you're gonna pull the leg back in and pull it up to your chest. And as you're pulling it up into the chest, make sure you take it into some external rotation and abduction. So the knee's gonna come to the side. And then extend the hip again. But swap sides now, so the opposite leg's gonna fully extend. You're just putting the other leg back into neutral, and then bring that leg back, and then pull it up into hip flexion. Change sides, so take that leg back down, swap sides, so you're going to extend the hip, and then pull it back in and fully flex. So flex, external rotation and abduction, and then swap sides. So we're just going from side to side. Just do a couple more. And then this next one, you're going to bring your knee up to your chest. And then grab hold of the ankle. And so you're going to grab hold of the outside of the ankle and the inside of the knee, and you're just going to start to mobilise your own hips. So you're going to try and push the knee out to the side and bring the ankle a bit closer in. So just mobilising through your hip, trying to create some external rotation in the hip. You can bring it into more internal rotation as well. So just alternating between external and internal rotation, just trying to mobilise through that hip joint. If something feels uncomfortable, don't force it. You just want to feel a nice springy feel. Then swap sides, take the other leg up, and again grab hold of one ankle and then push on the knee, and just try and create some external rotation. Might feel a nice stretching through your bum. And a bit of internal rotation if it feels comfortable. And then put that foot on the opposite knee, and then you're just gonna let your body twist to the side. So the leg that's bent, the figure 4 position, is gonna go, so if my left leg's over my right leg, you're gonna drop it down to the right hand side, and you should feel like a stretch into that hip joint. Look the opposite way as well. And breathe into it. And then bring your legs back. Swap the sides now, so your opposite leg's going to be going over the other one, and then you're going to drop your foot down to the floor on the other side. Look the other way. Breathe into it. Bring your legs back. Then we're going to make sure you've got your neutral pelvis, neutral lower back. So tilt the pelvis until you find that neutral position. Create your breath and brace. You're going to lift your bum off the floor. So in that glute bridge. Stabilise through one leg. Place the other leg on top of your other leg. So you're going back into your figure 4. And you'll feel again a bit of a stretch at the front of that hip joint. And just hold it there. So breathe into it. So you're really going to have to stabilise through that supporting glute. Push the floor down with the foot. Try and keep the hip up towards the ceiling. 5, 4, 3, 2, 1. Put that foot down. Stabilise through that foot and glute now. Swap sides. Let that leg drop out. Breathe into it. Push the floor down with the foot. 5, 4, 3, 2, 1. Put that foot down and then slowly lower your bum down towards the floor. Okay, so then we're going to create our breath and our brace. And we're just going to lift one leg up off the floor and slowly lower it down. And then the opposite leg. And slowly down. And as we're lifting the legs up into the air, we want this movement to come from the hip. So what we don't want is for the lower back to extend, the pelvis to go into an anterior tilt. So we're controlling that movement. And as you're bringing your hip up into the air, so you're flexing your hip, we're going to create some external rotation and abduction so that the knee is going wider than the hip and the foot is going narrower than the knee. And what you're going to do now, you're going to bring the leg up into flexion. As you take it down, you're going to extend the knee and the hip. And then pull it back. Bring the other leg up into flexion and then drop it down and extend the knee. And pull it back. Take the other leg up. Drop it down. Extend the knee. Keep breathing, so focus on your 360 breath and brace. And as we're extending the hip, again, we're keeping that neutral pelvis, neutral lower back. And then we're going to do a double leg lift. So you're going to take your breath in, create that 360 breath and that brace, and then lift both legs up off the floor into the 3-1 supine, and then double toe tap down to the floor and lift. So just in your own time now, slowly lifting and lowering your legs, and we are controlling the pelvis and lower back, so the pelvis does not want to tilt forwards. If this is too much for your lower back, if you start getting some pain or you can't keep your lower back flat on the floor, you can do single leg taps. Keep breathing, 360 breath. Just do a couple more. Bring your legs up into your 3-month supine. And then start to just do some hip rotations. So you're going to rotate one of your hips. Taking it out to the side and back in. And we're trying to control the body. So the body doesn't want to be rolling all over the place. This movement is just coming from the hip. Then you're going to go back the other way. If you need to, you can either put one foot on the floor doing this, or you can rest your foot up onto a chair if you're struggling to hold both legs up into the air. Just a couple more rotations. Then you're going to just bring your knees into your chest, give your hips a little, knees a little hug. Legs back, then you're going to do the opposite side. So rotate the hip on the opposite side. And then go the other way. Maintain that lower back, neutral pelvis. Keep breathing and pause and bring your knees into your chest again. Give your hips a little hug. Knees a little hug, should I say. Legs back into your 3-month supine, fingertips pointing to the ceiling. You're going to lift your head slightly and you're going to look to the direction that you're going to turn. And we're slowly going to go onto our side and then roll back onto our back and go the opposite way. So as we're rolling, we want to go nice, slow and controlled, so we don't just want to land on our side and throw ourselves back, and we want shoulders and pelvis to move at the same time. So we want our Lego body, so we don't want to disconnect, so we don't go pelvis and shoulders or shoulders then pelvis. And as we come onto our side, think about getting stacked up on top of the shoulder, stacked up on top of the hip, and a straight spine, so we're not bananaing. So side to side, use the top arms like you're trying to reach for something. Keep breathing. Just do a couple more from side to side. Then you're going to roll up into a lower oblique sit. So up onto the forearm, make sure the shoulder's nice and active, legs are in your mermaid position, and we're just going to start to rotate through the hip. So create internal rotation, external. So internal, so really try and focus on that movement through the hip. Keep the shoulder active as you're doing this. And breathe. Keep your spine nice and straight, so we're not just bananaing through the spine. Just do a few more. Then we're going to lift up into our high oblique sit. and we're going to do some hip rotations from side to side. So bring the knees up, take the legs round to the opposite direction, and rotate back through to the opposite direction. So we're creating internal rotation in one hip, external rotation in the other hip. And as we come through into this tall sit position, make sure you are tall. So we're not rounding through here. So we're going to drop the legs one direction and into the other direction. Mobilising through the hip, feel that rotation. And then rotate through to the other side. So high oblique sit, lower down into low oblique sit, and rotate through the hip. So create internal and external rotation. Keep the shoulder active, so make sure it's not pushing forwards and it's not elevated, so creating external rotation, depression through the shoulder. Okay, just a couple more. Lift up into high oblique sit. I'm going to turn around so you can see me. Then we're going to do some lift and into rotation and then down. So we're going to hinge forwards in this oblique sit, lift up through the hip and rotate. So you're going to rotate through and then you're going to slowly lower down. So if my knees are pointed towards the left, you're going to rotate round towards the left and feel that rotation through the hips. And then slowly lower down. So you want to go nice and slow so that you don't end up hurting your knees. So lift, rotate. So just in your own time, lifting and rotating. See if how far you can go with that rotation. Okay, just do a few more. Then you're going to lower down, rotate round the opposite way and do the same. So lifting, and now you're going to rotate to the opposite way. Slowly down. Lift, rotate. So just keep doing that in your own time. Use your breath and your brace. Just a couple more. I'm going to rotate back round the other way. Okay. So then we're going to go up into our lift and we're going to go into our high kneel, but we're going to move the foot around. So you're not just going to go straight forwards. You're going to go forward, you're going to bring it round and back, forwards. So you're creating different ranges of movement. So from this lift position, we're going to stabilise through the supporting like butt area. So push the floor away, try and think about creating external rotation in that hip, and pull the leg through into a high kneel position, and then take it back through behind you, and then you're going to come through again, but you're going to rotate round, so you're going to move your foot to a different position and then bring it back, and just keep moving your foot around like in the high kneel position, so you're getting different ranges of movement through that supporting hip. Control it, don't let yourself fall. And when you come into your high kneel position, make sure you've got the good position. So we want the pelvis level with the floor, neutral pelvis, neutral lower back. So we don't want to be hiked. So we don't want one side of the pelvis to be higher than the other. Just do a couple more on this side. And then lower yourself back down. Go the opposite way. And do the same on the opposite side. So lifting. And then stabilise, bring the leg through. And stabilise and back. Stabilise, bring it through, rotate round on that supporting hip, and then make sure as you bring your leg back down, you bring it all the way round. Very nice. Okay, just do a few more. And then we're going to come up into the high kneel position. And then from high kneel, getting a bit warm now. Make sure your pelvis is level, and we're just going to lift up slightly and externally rotate the back hip and foot, but keep the front foot facing forwards. And then rotate back round, down to high kneel, lift up, rotate. So as you come up, the front foot stays facing forwards and the back foot and hip externally rotates, and then back down. And up, rotate through that back foot, back knee, back hip, and back down. Make sure the pelvis goes with you. Keep your balance. Okay, just a couple more. And then what you're going to do is we're going to do a split squat, lower down, and then high kneel to stand, lower down, split squat, lower down. So we're going to lift, slowly down, stand, slowly down, lift, slowly down, stand, slowly down. So with this position, what we want is for the pelvis to stay level with the floor, pelvis staying facing forwards, knee to keep tracking the second and third toe. So we're going to concentrate, keep the pelvis facing forwards, level with the floor. So you're just going to extend both knees. Try not to let the knees cave in. Slowly down. And then you're going to, the next time, you're going to bring that front foot forwards. If you've got a chair nearby that you need to hold on to, so that you've got a bit better balance and you can keep yourself in a good position, then that's fine. Then you're going to go into your split squat again. Keep your knees driving out, so knees tracking second and third toe. And then stand. And just go really nice and slow and controlled. Just do a couple more on this side. And then lower back down. Then we're going to pick up our imaginary ball, rotate round to the opposite side. And then we're back into our high kneel position. And we are going to rotate the hip and down. Rotate. So front foot stays facing forwards, knee tracks the second and third toe, and we're rotating the back foot and hip and knee. Keep the big toe driving down into the floor on the front foot. Keep the knee tracking the second and third toe. Just a couple more. And then we're going to do our split squat. Down, high kneel to stand, down. So pelvis level with the floor, make sure we're not too narrow with the foot. Neutral pelvis, knee track second and third toe. Stand, so down, stand, pull the foot forwards. And back down, really slow, really controlled, split squat, down, stand. Keep those big toes pressing down into the floor. Keep the pelvis facing forwards, keep the knees tracking the second and third toe. Do a couple more. Ooh, lost my balance. Okay. Lower yourself down. Pop your hands down to the floor. Take your front foot back into your bear and then lower down onto your knees. And then onto your forearms into low quadruped position. So we're going to tilt the pelvis backwards and forwards. Find our neutral pelvis, neutral lower back. Push the floor away with the shoulders, create external rotation and depression with the shoulders, lengthen through the spine. And then just start to hinge your hips backwards. So hinging the hips as far back as you can go and just hold that position and breathe into it. Focus on breathing that 360-degree breath, feeling that expansion around the abdominal wall. Breathe in through your nose and out through your mouth. Couple more breaths. And then you're going to extend your hips. So we're keeping control of the pelvis and the lower back. Come up onto both your hands into your quadruped position. Again, find your neutral pelvis, neutral lower back. Push the floor away with both of your hands. And then we're just going to hinge backwards and forwards. So we're controlling the pelvis. So hinge backwards. So this movement is coming from the hip, not the lower back and pelvis. And then we're going to extend. So slowly backwards and forwards. Really trying to focus on what is happening in the pelvis and lower back. See whether you can feel whether there's any movement. So what you don't want to do is be rotating and extending, flexing the hips and flexing the spine, and then as you come into extension, you don't want to be extending the spine. So neutral pelvis, neutral lower back. So backwards and forwards, control that movement through the spine. Just do a couple more hinges, backwards and forwards. And then you are going to make sure you've got your neutral pelvis, curl your back feet under, create your breath embrace, lift your knees off the floor into your bear position. Breathe into it. So focus on your 360-degree breath. Push the floor away with your hands. Pause. Then you're going to start to slowly hinge your hips backwards. So your bum's moving backwards, folding the hip. Walk your hands back into your squat. Okay, try and lengthen through the spine. Pause there, so we're in an active squat. Lower down into a deep squat. So you'll feel that flexion through the spine. Breathe into it. Feel that stretch into the lower back. Breathe in through your nose, out through your mouth, and then we're going to come into our active squat and slowly stand up. And as we're standing, we are controlling the pelvis and lower back. So we're going to do some squats now. So squat to stand. Focus on keeping control of your lower back and pelvis. So lifting and lowering and just thinking about what's happening through your pelvis. So if you need to, put your hand on your tummy, one hand on your back. Make sure you've got your neutral pelvis to start with. So tilt your pelvis forwards and backwards until you feel like you've got your neutral. And then we're just going to start to lower down. And if your hand's on your tummy and your back, and if you start to feel your pelvis tilt, then just try and correct it as you're lowering down. And then slowly come back up. Try not to overextend your lower back as you're going down. So we're controlling that neutral pelvis, neutral lower back. Just do a few more, nice, slow and controlled. Keep lengthening through the spine. Okay, last one. And we're done. Right guys, hope you enjoyed that. I'll see you all soon.